Good morning, good afternoon, good evening to you, wherever you are in the world. My name is Sarah Shaw and I'm part of the ISBNPA NESI committee. Thank you so much for joining our webinar, which is jointly hosted by the Early Career Researchers Research Committees of UKSBM, ISPAH and ISBNPA. The past couple of months have been quite crazy for all of us, and we've seen some massive changes to our everyday lives due to the coronavirus pandemic. For many of us as students and ECRs, this has meant massive changes to our research as well as our personal lives. We're really glad, therefore, to have this opportunity to have this webinar to discuss some of the challenges you may be facing, but really to show you that you're not alone. Before we begin, I would like to remind everyone that this is one of many webinars aimed at early career researchers. We have recordings of all of these on the ISBNPA website for anyone who isn't able to make the live sessions. We advertise all our upcoming webinars on Twitter, so please keep an eye out for those in the future. Moving on to today's webinar, I would like to start with some housekeeping pointers and explain how our webinar will run. All audience members are muted by default to avoid interruptions and background noise. During the first half of the webinar, our speakers will share their experiences of life during the coronavirus pandemic. They will talk through some tips and coping mechanisms to deal with how some of us may be feeling at this current time. The second half of the webinar will be a discussion session with the opportunity for you to ask questions, but we'd really like to use this time for you to give and share your experiences of your research and personal lives during lockdown. So please join in and let us know if you have any advice or any tips that you would like to share with your fellow ECRs. You can do this by either using the Q&A box, or you can raise your hand and interact verbally with the panelists. Today, I'm one of the moderators, and I'm joined by my colleague Sofia Strommer, who is chair of UKSBM Early Career Network. And that just leaves me to finally introduce our two fantastic speakers. First, we'll hear from Professor Annie Anderson from the University of Dundee. Annie is the president of the UK Society of Behavioural Medicine. She is going to share some experiences of conducting research during the COVID pandemic and get us thinking about what this might mean for us in going forward and in our future careers. And then Annie will be followed by Professor Kylie Ball from Deakin University in Melbourne. Kylie is the past president and the fellow of ISBNPA, and Kylie is also the author of the Happy Academic blog, and she may share some details about this later with you. So without further ado, I'd like to ask Annie to join us and share some of her tips. So Annie, can I just pass over to you?
Thank you. Thanks very much indeed, Sarah. Hello to everybody. I don't feel very expert in this area because I don't think there are experts in what we're going through at the moment. And I think there's a lot of things happening, and all of us react in different ways in our careers and in our home lives. So I'm going to try and say some very positive things, but I know that behind those positive things, there have been difficulties, and we've all had some difficulties. So the area that I work in is the area of behaviours related to cancer. So I'm very much engaged with other cancer researchers, including behavioural scientists, people who work on physical activity, diet, weight in terms of cancer, people who work in cancer screening and understand the behaviours associated with uptake of screening. And I went to our cross-party group on cancer last week, and one of my UKSBM colleagues, Katie Robb from University of Glasgow, presented some of these slides, and I think it gets home very clearly the situation that many of us are in that universities are partially closed, experiments and other research, many has stopped or paused for a lot of people. Researchers are continuing to work productively from home, but the progress of research will slow down. It'll slow down for each of us and for our whole community. And this will have an impact on researchers' careers, and it'll have an impact on the lives, in this case, of people affected by cancer or the other conditions that we study. So we're all in this together. We're all facing this in our different ways at this time. And in terms of the research environment, we need to be aware of what our current research limitations now are, what future research investment might be, our workforce. And this is why I think early career perspectives are so important, but also looking towards the future about restarting research and our priorities for recovery in terms of research as well and going forward. And it does mean that we have to stop and think about where we're moving to in terms of our next research or continuing our research. And just to elaborate on the ways in which research has stopped, this relates to cancer area in terms of patients entering trials. And this is a table of international data on the difference in uptake of trials across the world. And it's first of all looking at the difference between March 2019 and March 2020. If you just look at all countries in terms of trials, it's minus 65%, and by April it was minus 79%. And obviously it varies throughout the world, but everywhere has been hit with this. So we're all coping together with this particular problem. In terms of the UK perspectives, our Association of Medical Research Charities estimated there was a 252 million shortfall in the charity research medical sector, which means that priorities will need to be made. If we look at Cancer Research UK, which is our biggest cancer charity, there's a huge estimated drop in income, with large cuts being made, including direct research grant cuts to the university of funding already given. And medical research charities spend 87% of their funding in universities. And so in terms of reduction of economic output, we are all anticipating that there will be a downward trend. And I'm going to go on and talk about some opportunities and considerations around that, but I came across this statement, I suppose, these guidance from Canada, and I really thought this is just so apt in terms of thinking about what we are actually doing. Because if any of you listening are like me, I have certainly thought that I've never worked slower, I've never been less productive. I have a super home environment, it's good for working, I live in a super place. But getting my head around all the things I used to do has been difficult. So when this message says you're not working from home, you're at home during a crisis trying to work, I think it's really important to remember that. And physical, mental and emotional health is far more important than anything else. So it's a bit about looking at my to-do list and thinking of all the things I've got to do, and just looking at them again and thinking, what is absolutely crucial? What will get done and why does it need to get done? You should not try to compensate for lost productivity by working longer hours. That doesn't work. We've got to try and balance what it is that we want and need to produce, and being kind to ourselves is really important. And Kylie's going to say a lot more about this, but the bottom line here is your team success will not be measured the same way as it was when things were normal. So in the UK, we've got the UK REF coming up, and there's obviously quite a bit of movement there in terms of how things will be assessed and the timings and so on. So I think the pressure there is always pressure there in terms of research and research outputs, but we're all in this boat. It will not be the same pressure. So it's okay not to be okay. We still want to achieve, we still want to have outputs, but we're going to have to view our goals differently. And there are challenges for us as a research community, as in the public overall, because the diseases that we try to manage or prevent remain. So our public health research efforts need to be maintained. Everything just now is shadowed by COVID-19, as it must be, as we try and find solutions for both the behavioural action, to support the behavioural actions required, understanding health, as well as the clinical aspects. But we have many skills relevant to the COVID-19 research efforts as well, understanding behaviour, whether it's shielding, whether it's social distancing or other requirements, we can add to that. And many of our UKSBM members have been involved in government committees and advisors on behavioural change. It doesn't mean to say the government has listened to them, but we've contributed. And we want to make sure that governments maintain their strong commitment to supporting science, research and innovation beyond COVID-19. Research will not disappear. And I think many of us who are in senior positions feel that we must protect our research expertise, particularly our early career research pipeline coming through. But because without new researchers moving through, we will not be able to move on in the disciplines that we work in. So I think there's a very, very strong will to help early career researchers as much as possible. But we do also need to recognise that we have to wait for research to start when it's safe and commensurate with the capacity to be able to do the things we need to do. And that isn't yet for any of us here in the UK. And we recognise that there are all sorts of challenges that people have had, and many of you who are listening to this may like to tell us some about that. Short-term contracts are never fun for any of us. I was in short-term contracts for years. You never know what's happening at the end of that contract, and it's even more hard to imagine now. And then on top of that, you've got the uncertainty of extension, of ongoing funding, of no-cost funding, and so on. And there isn't a clear picture coming out on what will each individual funder will have different views and different policies on that. And then we also have the condition of people being furloughed, where they can't actually do work. I can't imagine anything worse than not being allowed to work. And so you can't write a grant application when you're furloughed. And those frustrations are huge. And then for many of you, there's issues about what the next research job, where, when, how. They're always there for people in contracts, but also continuing a REF eligible career. And then there are issues of access, and that's access to participants, if you're recruiting, research environment, equipment, and many of us, our research environment has gone completely online if we've been able to continue at all. And I think using the support that's available to us is hugely important. And that's not just for early careers, it's for midterms as well as senior careers, our peers, our supervisors and external mentors. And I know that ISBNPA has a mentor program, and later this summer we'll see our UKSBM mentor program starting too. And this is a time to use whatever support and advice you can get. And these are two of colleagues from UKSBM. Mari, who's actually our membership secretary, whose research was instantly curtailed, but in fact managed to get a bit COVID-19 related funding, so was able to change what she was doing to another project. And then a PhD student, and her research requires completely redesigning. And then what happens post PhD? And we don't know, we don't have the answers for that, but I'd like to think we are all looking out for people going on to the next stage. So what about research in time of uncertainties? Data collection For some people, they can't get started. For some people, they've had to pause. For some people, they've had to finish early. But what can you learn from the data you have? And I think we just need to be clear on the limits of that, the strengths and the weaknesses, and flag up what has happened in terms of the impact of COVID-19. Can you make changes to the protocol? Can you collect complementary data from other accessible sources? Can online data collection work? Is this a project in itself, and understanding the differences between online and face-to-face work? And how might you validate the data that you have if you've collected it in a different manner? And what if there are other COVID-19 waves? How do we plan research for going forward in that? And how does our ethics and governance bodies allow us to act quickly in terms of potential projects that may become available now? Writing, there's always writing, isn't there? But maybe for some people there's more time, maybe there's less time. But where there's time, writing it up for publication, writing it down for new grants or redeployment, and writing on a wider scale around public understanding of science, blogs. I put the conversation, which is a very popular academic writing opportunity. We're all under pressure to do more work on public understanding of science. There's a little window there. And what about old and new skills? Presenting research webinars, expertise in online platforms. And if anybody's got good expertise, I'd like to learn, please. Online teaching. We will be doing most of our teaching next academic semester online. Always a good skill to have. And providing peer support as well. So there are lots of things that we can do to help each other. And I'm going to just wind up by saying, I think one of the things that's really important is to keep a personal record of what's going on for you, what were your challenges and what were your successes. Each and every one of us will have this, and it'll be different. And at some stage, whether it's now or later in your career, you will probably need to say what has happened during 2020. So make sure that you keep a record of it and be absolutely clear on that. So some pointers only, and I'm going to stop here and move on to Kylie.
Thanks very much, Annie. I'm just going to start sharing my screen. That was great, and I'm sure people found that as reassuring as I did to hear that, you know, even the best among us are struggling with many of the same research issues. So I'm going to broaden our focus a little bit and talk about how to manage your life during coronavirus. And I'll start by saying, just like Annie, I'm certainly no expert in this, and I think it's probably a matter of more learning from what I've done wrong than what I've done right, that can be useful too. So let me... So just to start with a little bit about me, for those of you who don't know me, I've been an academic for 21 years now, and I was trained in psychology. That was my undergraduate and PhD training. I've also been a mother for 12 years now, a role for which I've had no training whatsoever, which my daughter likes to point out to me at regular intervals. Mentoring researchers is what I'm really passionate about in my professional life. And to that end, I started up a blog a couple of years back called the Happy Academic Blog. And it's a blog focused around trying to provide some support and sort of virtual mentorship to early and mid-career researchers. And in fact, I've posted about the COVID crisis on the blog that I'll refer to in a moment. But I also like to emphasize, I'm also passionate about life outside of work. And I think, like Annie alluded to a number of times, perhaps now more than ever, it's really important to, remember those parts of our life and take comfort and, invest in those parts of our life outside of our careers as well. So this is my blog. At the beginning of the COVID situation, around sort of February, I started thinking about posting a blog around the pandemic. And this was because, like many people, I was feeling really anxious about what was happening, what I was seeing happening around the world, first in China and then spreading to other Asian countries and then to Europe. And I had actually had a trip to Japan planned at the time for the end of March. And so I was, you know, even more obsessively than many, perhaps checking the statistics each day for what the numbers were doing and seeing them rise in Japan and in other parts of the world. And, you know, I really felt quite scared about what I saw going on. I couldn't sleep, you know, it was affecting other sort of areas of my life. I started to lose concentration at work. So it really did have an impact. And so as part of that thinking and trying to deal with that and planning for this post that I wrote, I went looking for some advice on the web and sought some, you know, insights into how other people were coping. But what I found wasn't entirely helpful, I have to say. So one of the things I came across was advice around what other people had done during previous pandemics. And so I found this piece that said, during a pandemic, Isaac Newton had to work from home as well, and he used the time wisely. So apparently Isaac Newton was a scholar at Cambridge University at the time, and Cambridge actually sent students home to continue their studies during the plague at that time. And for Newton, home meant Woolsthorpe Manor, which was his family estate about 60 miles northwest of Cambridge. Now, this is a picture of Woolsthorpe Manor, and I'm not sure about you, but this doesn't look much like where I've spent most of my isolation in lockdown. You know, I don't have the lovely sort of homestead home, the orchards to wander through. But what the article went on to say was that if you're working or studying from home over the next few weeks, perhaps remember the example that Newton set. Having time to muse and experiment in unstructured comfort proved life-changing for him. Now, I know this was meant to be inspiring, but I got to considering this and thought about, you know, this phrase, having time to muse and experiment in unstructured comfort. And again, I'm not sure if that describes your experience of lockdown during this pandemic, but it certainly didn't really resonate with mine, but rather, or with that of many other colleagues. You know, I knew colleagues that were really struggling in very small, suddenly having to cram their work into quite small spaces. A number of colleagues, you know, living in small one-bedroom apartments, for example, and suddenly having to, you know, shift all of their sort of working life to fit into those. Other colleagues had a little bit more room, but certainly, you know, not the order that's probably conducive to concentration at home, you know, trying to shift again, often not only your own, but sometimes your partner or your family's entire working and or schooling life to home, you know, it isn't always a smooth and easy transition. The number of Zoom meetings that suddenly everyone was dealing with and Zoom fatigue is a real thing that people were talking about, and I think took many of us by surprise. Homeschooling was, you know, lots of fun for those of us who had children, and I loved this picture that was actually posted in response to genuine HR advice to people working from home, that, you know, all they needed to do was set up their children with a fun activity that would keep them busy for, you know, a few hours, and then they could happily continue their work alongside. And the responses like this were quite amusing. You know, what about painting? Painting's a fun activity. So, you know, certainly the juggles of combining having young children at home, having school-age children at home, trying to help them with homeschooling and work as well has been a real challenge for some. And, you know, in many cases, trying to multitask, and if you can manage to wash your child and your dishes in one hit, you've probably had a really productive day that day. So, yeah, for certainly for myself, I didn't perhaps feel that this was a nice unstructured time to muse and experiment in comfort. Some of the other advice I came across was that Shakespeare apparently wrote King Lear and Macbeth under quarantine during a plague outbreak. And once again, this was, you know, intended to be inspiring, and perhaps some people were inspired by this, but I actually found I was more inspired by many of the responses to this that I saw on Twitter. And I'll leave you to perhaps read through a few of those, but, you know, certainly, yes, this inspires me. I will also write King Lear. Gave me a bit of a chuckle. So I guess, you know, resonating on the point that Annie made, you know, we're all in this together. I think I probably got more inspiration and support and comfort from reading about other people's, you know, struggles and frustrations with trying to cope with life in lockdown and everything else that was going on than perhaps some of the well-intended other advice that was out there. So how do we cope then? How do we maybe think about reframing what's happened? I guess the first point to make is that what is happening, what has happened, what continues to happen is terrible. You know, there's been many lives lost, many livelihoods lost. Our way of life essentially has been lost. I know many countries are at different stages of lockdown and recovery, but still, you know, we've all either gone or are going through, you know, terrible things around this crisis. So there's no denying that, I think, or no trying to gloss over that, or you know, pretend that it's not a terrible pandemic and terrible things that have happened. And I think acknowledging that is the first important step. I've actually had colleagues tell me that they're grieving for the loss of, you know, their old ways of life and projects that they've been working on sometimes for a decade to get up and running, and now seeing those end. So, you know, it certainly is the case, and there's no getting away from that what is happening is, you know, it's a really horrible situation. So having said that, and notwithstanding that, there are some positives to come from this that we can focus on. And I guess I've just listed a few here, and some of these may be relevant to some and not others. Certainly, while for some people the pace of life has increased trying to deal with all of those things that I just spoke about, for many people they've actually noted that the pace of life is a little bit slower, and that's maybe because they're not having to rush in the morning and struggle with a busy commute to work. Some people have had hours reduced, whether that's been, you know, a choice or not. You know, the pace of life has slowed for many, and I've heard a number of people say, you know, that's actually not been a bad thing for them. A lot of people have also said, you know, the increased family time, having more time at home with their family, their children, their partners, has been a positive. Certainly I've noticed, and I know others have commented, that local walking in your local neighbourhood seems to have increased, you know, with a lot of gyms closing and other kind of structured physical activity opportunities not available. It's, you know, it's wonderful to see people out walking around their neighbourhoods. There have been obviously environmental benefits as a consequence of, you know, industry and airlines around the world closing down. We've seen some, you know, great benefits to the environment in a number of places around the world. I've also seen great technological advances. So telehealth, which seems to have been such a struggle for people to get up and running, has, you know, in a matter of days or weeks, suddenly we're all able to access, you know, appointments by telehealth, which is terrific. And I think also the respect and the increased recognition given to science and to health research. You know, I don't think I've heard the word epidemiologist used by the media as many times ever as I have over the last few months. So, you know, that's a positive thing as well, that politicians actually are probably, you know, listening more often than they have previously to the voices of scientists and health researchers in this time. So certainly, you know, there are many positives, but as I said, feeling anxious or fearful or sad, or any of those other kind of myriad emotions is the sane response. It's a normal response at this time. So if you have been feeling that way, you're certainly not alone. So how do we cope with all of this? So the first thing I say is to try not to panic. I know it's really easy to fall into panic and feel that this is, you know, apocalyptic and the, you know, despair at the world, but there are some more reasons not to panic. And this conversation article lists 10 of those reasons relevant to the coronavirus crisis, which is worth a look. But also, as Annie said, lower your expectations. You know, we are all going to have a career interruption on our CVs this year. It's called 2020, and everybody's going to have that. So lower your expectations for career, but also for work-life balance. You know, trying to struggle to sort of attain this mythical work-life balance, whatever that is at this time. You know, you don't need that to be an extra challenge in your life. I think the key thing to remember, as Annie pointed out again, is, you know, working at home doesn't mean working non-stop. You shouldn't make up for lost sort of productivity by trying to just do more and more, because that's not going to help. It's not sustainable, and it's also not effective for your work. Instead, we need to be looking after ourselves and looking after others. And I'm going to finish with the last couple of slides about some ways that we might do both of those. So firstly, looking after yourself. I mean, we know better than anyone the importance of healthy behaviours during this time. So I don't need to tell everyone to, stay active and eat well. But the good thing is there've been lots and lots of resources come out around how to do this at this time particularly. So a lot of our sort of big running events, marathons and fun runs and things have gone online. They're now virtual events, including the Boston Marathon, which I believe it's the first time in its 124th, I think, year of history that it hasn't actually run in person. It's now being run online. So there are lots of virtual run events that you can find online, and that's one way to keep active if you're into running during this time. Similarly, there are lots and lots of other kinds of physical activities online, and many of these are free. So this particular link, Yoga with Adrian, is one I've been following for about 5 years now. It's a online yoga community with more than 7 million subscribers. The vast majority of the classes, many of them are free. It's a really fabulous online yoga platform. And these are just some selected examples. There are lots more out there, but I couldn't cram any more onto this slide, as you'll see when I'm finished. So take a look at many of the online virtual events. Healthy eating. So many of us have resorted to food deliveries during this time, and there are lots of organisations like Marley Spoon in Australia, which will deliver a bag full of all the groceries you need to make a healthy meal, which just takes that stress out of shopping, or the anxiety of trying to time your shop when there are not a lot of people around, or for a while home delivery shopping was cancelled here altogether. So yeah, these home delivery sort of packaged meal operators are worth considering at this time. Or if you can manage it, there are lots of plans out there online for pantry meals that you can make from staples, so things that you might have non-perishables in the fridge for a couple of weeks. So that's healthy eating. Managing stress, once again, some fabulous online resources for this, including the Headspace app, which I've been a long-term user of, and Simple Habit, which is a platform that's has a whole section particularly around easing your coronavirus anxieties. So both of these are meditation apps, and clearly that's only one way to manage stress, with physical activity being another. But yeah, worth checking out some of the platforms like those. Also, trying to get a good sleep is more important now than ever. I think I don't know anyone that hasn't had their sleep affected in some way by what's been happening. So again, if that's you, you're not alone. So visiting sites like this one, the 10 Commandments of Sleep Hygiene, and just trying to stick to some of those key tips is really important. And also, I was very guilty of this. Try to stop or limit the endless scrolling through the news and the media. I found early on, particularly, I just would fall into this trap of scrolling hours and hours and hours looking for some good news, or looking at what was happening with the numbers. And we know, when there is evidence that extended time online doing that kind of thing is not good for our psychological health. So try and limit that. Pick a couple of reputable sources that you go to and limit the time that you spend on those. And also look after others. Lots of people are struggling during this. Physical distancing is preferable to social distancing. So rather than, cutting off contact with people altogether, make the effort to socially connect with people. And this is good for yourself as well as good for others. But do take Zoom breaks, as I said, to avoid Zoom fatigue. Check in on your family, check in on loved ones and those in need. If there are elderly neighbours, I've seen some, lovely acts of kindness, which is my next point, around helping those in need with grocery deliveries, or other things that they might be struggling with during the pandemic. And get inspired by sites like this, the Kindness Pandemic, which is a Facebook site dedicated to sharing acts of kindness around the world. And there've been some amazing acts of kindness. So people doing free opera performances in their street, and people sharing their toilet paper stashes, and all sorts of kind acts that are really inspiring and nice to reflect on in this kind of chaotic, bad news environment that we find ourselves in. And finally, focus on what you can control. There's a lot of things about this situation that are clearly completely out of our control or out of our circle of influence. There's a lot that we can't do, but there are a lot of things we can do, and those that we can directly control include some of the things I've just talked about, including looking after yourself and others. So keep your focus to those things, and try to deal as best you can with managing your stress and anxiety about those that you can't. So I'm going to finish there, and I had posted a couple of questions that might hopefully get some discussion started, but yeah, perhaps I'll hand over to the moderators to take any questions or comments or shared tips from our audience. Thanks.
Thank you so much, Anya and Kylie. These have been fantastic presentations to watch, and it's actually really reassuring to just hear that we're not, each of us, going through this on our own, and that there are so many shared experiences that we're all sort of struggling with and going through, the endless Zoom meetings and, you know, the distractions in the background and partners and children running in and out and all of this stuff. It's quite nice when you do get to, you know, share those things with others. And so it's been great hearing from you guys. Just to start off with, we've had a question from our audience that I'd like to put to you. And it's not really a question, it's again, like many of these things, they're more discussion topics, I suppose, and please, our attendees also feel free to share your experiences of this, because personal experiences of this kind of thing is probably always better than, you know, advice that isn't necessarily grounded in that experience. So anyway, the question is from Catherine Sharp, and she is asking about whether we have any advice on starting new jobs at new universities during this period, which is undoubtedly a very, very challenging thing to do. So she was just wondering if there were any tips or any thoughts about how to settle in such circumstances. Do our panelists have thoughts?
So I think one of the most important things in starting a new job is not the work, but actually the colleagues that you work with. I know when I have a new member of staff, I do the kind of, this is what's expected, blah, blah, blah. And then they go out into the main office and all the team get together and they have a coffee and they chat about, you know, where the loos are, where best to go for lunch, the walks and so on and so forth. And I think that's a very important aspect of a job. So I think it would be important for the person to at least get some contacts who work in the same unit, and to try and find out what they would normally do with somebody starting and what's it like and what are the things to avoid, and actually imagine just not being in the workplace but from where they are, but to get some inside info so they could imagine it. And importantly, just to feel they're supported by people in that unit and to work up some dialogue. It doesn't matter how silly it is or how sensible it is, but to feel you've got contacts there.
Yes, fantastic. Kylie?
Yeah, maybe I'll just add, I think they're excellent suggestions. I in fact had a colleague in this situation. He's just started at my university from Canada, but of course hasn't even been able to enter the country. So he's commenced his job not only in the university buildings, but not even in the country. And so what we've tried to do is to, yes, similarly to the things that Annie suggested, ensure that he's well connected. And one of the things we've done is to set him up with two sort of mentors, more senior people, or actually one person at a similar stage and someone more senior, just to connect in with him regularly, informally, to see how things are going and to have those kind of informal chats, which could just be things about, you know, how are you coping with all of this? But yeah, I did comment to him, I felt for him, because I think it's a very strange time and strange situation in which to be commencing a new role. So yeah, support like that's really important.
Absolutely. Thank you, Kylie. Yes, we so Sarah and I have a colleague here in Southampton who's recently moved here from Australia, actually, and so she took up a new post with us, and she's basically moved right into the middle of lockdown. She was in an Airbnb to begin with for a couple of weeks. She's now managed to get a flat, but is having a hard time getting any furniture for the flat, and it's just sort of one challenge after another. And we've tried to very much include her in the sort of virtual ECR cafes and meetings and things that we have, just informal chats and things. And so I think something that you know, has struck us as quite important is that if you encounter anyone who has recently, you know, moved to your university in any context, try and take them along to any sort of social gatherings that you're taking part in. Of course, the supervisors and the teams that they're already working with have that sort of responsibility, I suppose, or they're the best placed people to do it. But also easier is in any capacity. If you see someone who's just joined in, I think it's a nice thing to do, I suppose, to try and include them in as many things as possible. And she's been a right trooper, so I hope she's finally finding some furniture for her flat.
We seem to have some of our fellow ECRs on the chat that have experienced similar things. So Elena says she's moved to the USA at the beginning of the year and set up coffee breaks with other postdocs. So that seems to be a kind of common theme that we all find useful. And I know that I haven't started a new job or anything like that, but even just taking the time out to kind of have those chats that you would normally have with people in the office that maybe aren't about work and just over a cup of tea or something like that. I find that really useful. So it's kind of those Zoom coffee breaks as well, just to, you know, work as part of your everyday life, and there's so much more happens in the office than, you know, the papers we write and the grants and the research that we do. So I think those coffee times are really important and really enjoyable and really good fun. Like, I've had really good laughs and just shared experiences. It's really been great.
I wonder if I could come in there. So I never have coffee with my staff. I just work all the time. But when we started lockdown, I sort of thought, I really miss everybody. Could I join people for coffee? So on a Tuesday morning, I Zoom host a 1-hour coffee session. And the idea of taking an hour off to have coffee to me is appalling. But you know, it's the best bit of my week. Now, they might meet each other for different times as well. But what I would say is, if you are meeting for a chat, invite your senior person to join in as well, because it, you know, I think we're all in this and there's some sort of common shared things. I've learned such a lot. It's great.
Yeah, absolutely. It's a good point. Involve not only your peers, but also your senior researchers. They could use a break. I know ours probably could as well. So it seems from our attendees, so we've had other comments in here, we've had other questions. For example, Bruno da Costa is asking about conferences, which is something we're all missing out on at the moment. So what sort of novel opportunities are there for ECRs at the moment to disseminate their work? And is there anything that's not on offer that could be on offer?
Maybe I'll jump in there. So I guess, yeah, it's really disappointing. This is perhaps one of the most disappointing aspects for many ECRs and many researchers in general, is the loss of the networking and contact opportunities with colleagues around the world at conferences. So I guess what I've seen is that many of the conferences have attempted to go ahead in some format online. And so I'll take this as an opportunity also to spruik the ISBNPA conference, which has moved to an online exchange forum and will commence in a couple of weeks. So that's one great platform for networking and so forth. And I guess, again, this theme of kind of, you know, connecting via Zoom and online, I think at the moment, you know, this is an opportunity for us to consider our networking, you know, using these kinds of platforms. And I notice a couple of the comments there, you know, people have actually talked about that this has been a real positive, that they've got to know people, you know, even better through connecting and networking via Zoom. And I've certainly found that as well, and probably spent more time with my family in other states and countries than I had previously, you know, on Zoom calls and Zoom meetings. So I guess, again, you know, make the most of those platforms, and also, you know, join up to those virtual online conferences when they are offered and when you can.
Thank you so much, Kylie. And yeah, so the ISBNPA conference is coming up, which is fantastic. So it would be great to see all the presentations for that that have been recorded. And from the UKSBN Early Career Researcher Network, we're also planning to put on some webinar style sort of flash talks and poster presentations. So keep an eye out on social media. We will be posting more information about that, but we're definitely planning more ways for ECRs to be able to disseminate their work. Okay, and the other question that has come up is about PhD candidates who have to defend their theses in the middle of this pandemic. So obviously, you know, the defense is moving on to virtual platforms. How does that change the dynamic, and does anyone have any tips?
So in Australia, we currently don't have the oral defence, so perhaps I might defer that to others that have that experience.
Yeah. Okay, so I share my house with my husband, who's an academic, who did a Viva last week. And in fact, it was a master's Viva, not a PhD Viva. It took 3 hours. And I couldn't think that to do that for a master's Viva. But everything is just a little bit slower. And understanding interactions in Zoom and making the candidate feel comfortable took a bit longer. And I noticed that they had got a 3-hour slot. So everybody was aware that it could take a long time, and to make time to feel relaxed. So that, I think, is quite different. And the other thing is, I've always felt with Vivas, it's really important that people do a mock. And they have preferably a mentor or somebody that they can be put through a mock examination, and I would certainly recommend that. It's the case every time, but to do a mock in this time, because you probably won't have done a Zoom presentation before, is even more important. And don't be frightened about asking for that. I think it's really, really important. So those are the two immediate things that come to mind for me.
Thank you, that's really valuable. Is there anyone in attendance who's done their Viva recently online? Please do let us know in the chat, and I'll share with the panelists as well, if you do. But in the meantime, we've got more questions. So one of the things that's happening at the moment is obviously research pace is slowing down, and some people's research is having to be put on hold. But the race of research is not disappearing anywhere. So the question from Jessica Leather has been, how do we stop comparing ourselves to colleagues who might be coping better or appear to be, publishing all of their papers right now, and they're, yelling all over Twitter about it, and so you start feeling like you're really falling behind? How do we stop doing that?
Mm-hmm. Okay, so I'm a great believer in sitting and documenting what you have achieved rather than what you haven't achieved. So that sense of writing down both your situation, the things that have made life a bit tricky, and there could be all kinds of things. There could be what's going on in your head, or there could be what's going on around you. But thinking of what you have actually managed to do, particularly if the circumstances have been really bad, and holding on to that, I think, is really, really important. And it's really hard to not compare yourself to others, but just like the Canadian thing, it's actually, you just need to go with what you can do at this time. Won't always be like this, but just feel positive about yourself. And I would just take each day or week at a time and think what's been achieved rather than what hasn't been achieved. Mm-hmm. I know that I've had to do that, frustrating though it is. But cumulatively over the weeks, actually things have been done. And it's just working at that different pace and time. So comparing yourself is really, really bad, but it's hard not to do. But feel proud of what you have achieved rather than what you have.
Yeah, fantastic. I think we're all guilty sometimes of comparing. Kylie, what do you think?
Yeah, I mean, that comparison game can be a double-edged sword. What I say to people is maybe rather than compare them from a perspective of kind of frustration or envy, can you actually be curious about it? And if you know them well enough, can you ask them how they are achieving what they're doing? And I think the comparison thing, for me, making big comparisons like where someone's at in their career stage, or how many papers they have, or how many promotions they have, that's not very helpful. But what could be helpful is comparing, well, what's your strategy for being productive at the moment? How are you managing to write so much, and using it as a sort of opportunity to be curious about those things. That can be useful. But also, I guess, remember, you never completely know what's going on in other people's lives, and you don't know the full story, and similarly they don't know the full story that's going on for you. So I think coming back to the excellent point that Annie said, you know, focusing on what you have achieved and what you can do is, you know, really important as well.
Yeah, you're completely right. It would be an amazingly positive place to get to see each other as resources for trying to understand the best ways to go about pursuing an academic career, rather than seeing each other as always competing with each other. Thank you. So related to this kind of productivity, I had a question actually that I've been trying to figure out. What does furlough look like for an academic whose work life so easily bleeds into our regular life? So is furlough just giving up your core tasks? Do you still keep doing committee responsibilities? Do you still keep writing all the papers that are on the back burner? So what does furlough look like for us?
Can I say, I have that exact question too, Sophia, because we don't have that term in Australia, or that concept. So I'm curious to know what that is and what that looks like as well.
I'm not sure if anyone who's on furlough attends webinars at, you know, and whatever time it is in early morning or late night. If there's anyone here who has close colleagues or who themselves are experiencing this at the moment, please let us know. I have colleagues who are on furlough and some who are waiting to hear, sadly at the moment, whether or not they might be. But I haven't really heard very much from them, so I don't really have a sense either. Annie, do you know? Any?
Just the advice that our university gave, that if you are furloughed, you mustn't do any work. So you shouldn't use your email. So that makes it very hard to function, full stop, doing any work things at all. And Mari, that I mentioned from University of Glasgow earlier, had been told that you shouldn't write any grant applications. And you shouldn't really be writing papers and things. I think it's very difficult for people not to do that. And I think if they choose that to do that in their furloughed time, then I would not stop that. But you wouldn't want anything to be produced and put forward during that time. I mean, it's new. We don't, you know, we're experiencing this for the first time. And if there are some people who are being furloughed who have other things going on as well, so they have childcare, they have parental duties, and so on and so forth. So it may be a welcome break in one way, but on the other hand, panic about the research. But many of us do research in our own time. So if furlough means we've got our own time, then I think it's still possible to do research. Not sure if I'm supposed to say that, but I think that that's how most of my research colleagues would feel. And I'd be really interested to know if anybody is in the audience here who's had different experience or advice.
Yeah, I'd be really interested to hear that too. I think it's interesting you say, no, should we be saying this? And but I think what you've said is the honest truth, that as academics we would probably feel like that's a time that we can then use to do those things, the grant writing and the paper writing, that is always, you know, secondary to the more immediate whatever's happening in your inbox. Yeah,
if your headspace allows it, I think. I mean, I think being furloughed is a pretty big hit.
Yeah.
So doesn't necessarily mean that you can get your head around doing things.
No, absolutely. Yeah, there definitely are big challenges of being at home and dealing with all of the household things as well, family and everything. Okay, we're coming up to about 5 minutes to our finishing time. So last questions, if anyone has any additional questions, please do send them to us in the question or answer box, or put your hand up. We're very happy to hear from you in that way as well. But just,
I would like to ask a question, sorry, Sophia. So technology has been fabulous during lockdown. Like, it really has been a great way to connect with family and friends, but also to get work done and to conduct work in different ways and conduct research in different ways. But one thing I find is it's also really hard to switch off. It means that it's great to connect, but it also means we can't really disconnect. And I was wondering if you have any advice on maybe how to deal with that, on ways to, you know, like, do you have any tips or anything that you do to switch off and feel that it's appropriate to switch off and not be contacted by work colleagues with that sort of thing?
Yeah, maybe I'll say, I mean, that's a real challenge, isn't it? And I think this is one example of where it's, you know, do what I say, not what I do. I guess, you know, there are, ironically, again, there are technologies out there that can help with this. So there are things you can do, for example, on your phone to limit your screen time or limit your time on particular apps like Twitter or a news app or things like that. So, you know, that might be one strategy people can think about. The other things I've heard people talk about is, you know, having and it's really different for different people. So I think you have to choose what works for you, but having a set point at which you draw a line and say, you know, after this particular time, you know, I'm packing up the laptop, or I'm packing up, you know, and you know, doing something else. This is my time for exercise or family or meals, or, you know, so being quite clear about it in that way. But again, I think it's just a matter of finding an approach that, you know, that does work for you, and trying to stick with it. That the temptation is yet to be on all the time, simply because that boundary between work and home life is no longer there at the moment. So it's around finding new practices, I guess, that yeah, that do work for you. Yeah, and being kind to yourself if it takes a while to get there.
Yeah, I sort of had to confront this a couple of weeks ago, because I found myself being really anxious if my laptop stopped working. How would I cope? You know, it become the kind of center of my life. And that, I mean, real anxiety, you know, waking up in the morning and thinking, oh God, if it's not working today. And I think that just made me rethink that there are other things around that I can do and do enjoy without always being on screen time. I've got my phone. I'm sure I could get help from my IT department, but let's just put it back into perspective again. So I think the realization when you hit that actually your life has been taken over by computer use is the time where you need to really start thinking what those rules might be. Yeah.
Thank you. Sorry, go on, Kylie.
Yeah, I suppose in many ways it's not something that's new to this period of time. That quite often we have difficulty switching off, whether it was back in our old working life or now. But those tips are really helpful, and it's nice to hear that I'm not the only one maybe experiencing that it's hard to switch off.
Sarah, can I add too? I noticed one of the comments earlier in the chat from Hannah Sponsorley, just noting that since the pandemic, she's achieved or she's experienced an achievable planning for the first time since the start of her project. So I think it's great to acknowledge and share those sort of positive experiences too. So, you know, too often we're just hearing about the negative impact it's had on students. But yeah, I was, you know, heartened to read that, you know, there have been positive experiences as well. So thank you for sharing, Hannah.
Absolutely. Okay, so then I suppose I would just like to summarize that actually I think the most important key takeaways, at least for me, from this webinar have been to be kinder to ourselves and also to each other as we're adapting into this new situation, doing what we can and not comparing ourselves in a competitive way to each other, but rather trying to seek support and resources where we need them in some way. And yeah, and just finally to say from me at least, thank you so much, Annie and Kylie, for speaking to us today. It's been fantastic hearing from you.
It's a pleasure. Thank you.
Yeah. Thank you, and thank you to Antonio from ISBNPA for helping with all the technology and helping to host the meeting for both associations. And thank you to you.
Pleasure.
Yeah.
Thank you.
Many thanks. Many thanks all.
Thank you all.
Bye-bye.
Bye.
See you soon. Bye.